All right, today we've got Milwaukee's top pharmacist coming in for some chiropractic care. She loves running and staying active. So we're going to go through her spine. We're going to look for any bones that are subluxate. That means misaligned, interfering with her nervous system. Correct those, allow her body to work from the inside out. All right, so let's have you turn your head to the left, head to the right. I'm going through a and head in the middle, specific protocol. This is how we find what's subluxate, then we're using this tool. Our integrator is always to make it very precise and specific. We're not twisting and popping her spine and hearing 50 things crack in her back. Just a nice, gentle adjustment starting at C2. All right, let's have you go ahead to the left and then to the right. All right, so her neck is clear. We're going to look at the low back. See how the nerves are getting from the brain down into the legs? Maybe lift there and then lift here. Does either one feel heavier today? Left one feels heavy. So I'm watching her breathing as well. Her breathing will change while I'm adjusting her because we're stimulating her parasympathetic nervous system. That's the rest and relax part of her brain. Helps her body heal and recover. All right, try the left. Is it lighter or still heavy? Lighter. Okay, it's lighter. Give me a deep breath in. Let it all go. So we're doing these ribs over here. This is going to help relax her hip flexor. A lot of patients come in, their hip flexors will be tight. We don't want to stretch the hip flexor. She's an athlete. She's got good flexibility. We want to get the hip flexor to let loose. So we want the nerves to stop telling it to tense up. So now lift there. Is that lighter? Much lighter. I could feel that it relaxed. Now the muscles in her low back are working the way that they should. And now we're going to check out the knees and feet since she loves just staying active. All right, on your back, ma'am. All right, so let's start. We're going to check knee alignment and structure. Hold that nice and tight. Left knee is good. Bend here. Hold that tight. Right knee is good. I'm going to go through the feet. All right, you guys remember how many arches are in each foot? Anybody? There are 3. You have the outer or lateral, the medial, and then the transverse arch. So when we're walking, the weight enters the heel, goes through the outer arch transverses or transitions to the inner, and then your weight should push off the toe. The big toe should be the last thing in a normal gait to come off the floor. So with the arches, what I'm doing is just making sure there's movement. Every arch should have some spring in it. We don't want them to feel rigid. And if arches work the way they should, they don't need support. They are the support. Because if you support a support, you weaken the support. All right, we checking the head today for you? Yes. All right, so we're going to work on sinuses as well. Lift your head up. Lay it down there. All right, we'll do a little distraction on the face. Helps keep the sinuses flowing properly. And then after this, we have her husband. Couples who get adjusted together have the best marriages. It's been proven by science. No, I don't know if that's true, but you know, it's good. It's good. Exactly. Couple adjustments. Keep breathing, tongue on the roof of your mouth, relaxes your neck muscles. I'm just going to check these upper ribs. Nice deep breath in. I've got to get your left first ribs. Feel a little tender. These upper ribs are important for the jaw. Open wide, close. Like new.